Is your joint pain or arthritic pain much worse when the barometric pressure changes? I had a patient recently that suffers from rheumatoid arthritis, and they mentioned that when Hurricane Florence came through recently, the associated barometric pressure drop made their rheumatoid arthritic joint pain much worse. And they have noticed this over time during the course of their illness, but they've never been explained or told, or the reason why has never been shown to them for the increase in pain with barometric pressure. That's what we're going to dive into today. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Why do your joints hurt more when barometric pressure drops? Let's dig in. So when we have a decrease in barometric pressure, what happens is that there ends up being a decrease in the relative oxygen in the atmosphere and a decrease relative oxygen you take in per breath. This decreases the relative oxygen of your tissues. So when oxygen levels go down, that's a bad thing, and the term for that is hypoxia, which is fancy for low oxygen. Well, hypoxia results in what's called increased hypoxia-inducible factor 1 alpha, or HIF1 alpha for short. And HIF1 alpha is very pro-inflammatory. So the drop in the barometric pressure leads to a drop in relative oxygen per breath, leads to increased hypoxia, increased HIF1 alpha, and increased inflammation. So low tissue oxygen, increased inflammation in the tissues, and specific to the joint or arthritic sufferers, those tissues that already hurt on average and are already more inflamed even when barometric pressure isn't low, become more inflamed due to the hypoxia, and those are the tissues in you that are going to hurt more with any barometric pressure drop or any hypoxic stimulus. Say you're a smoker, that's a hypoxic stimulus. Say you travel to altitude, that's a hypoxic stimulus. So it's not just the barometric pressure drop. So if you are noticing, hey, my pains increase associated with X, Y, or Z, dig into what X, Y, or Z are and whether or not those are hypoxic stimuli.